If you want to understand what Medicare is without having to listen to a sales pitch or confusing insurance jargon, you're in the right place. In this video, I'm going to explain all the different parts of Medicare, what they cost and what they cover, so you won't feel confused or overwhelmed, but rather equipped with the knowledge that you need to get the best Medicare coverage possible. Hi there, I'm Marvin Music. And on this channel, our goal is to provide the best Medicare education so that people can avoid making the worst Medicare mistakes. So if you're new to our community, please feel free to hit the subscribe button. Also, hey, we know that Medicare is complicated, so if you ever need one-on-one assistance, we can help there as well. We are independent Medicare brokers, and every month we help about 1,000 people all over the country with everything Medicare related, including their Medicare A and B enrollment, shopping and comparing supplemental plans, advantage plans, and prescription drug plans. Our services are 100% free to you. So if we can help, give us a call. And make sure you stick around to the end of the video, because at the end of the video, I'm going to show you how to avoid what I think is the biggest mistake that people often make when they go on Medicare. So what is Medicare? Well, Medicare is a huge government system that started back in 1965 that's grown into a bloated government system that covers 85 million people today. Now back then, Medicare was simple. We had A and B, but now 57 years later, we have A, B, C, and D, and 10 supplemental plans, hundreds of advantage plans, and drug plans to choose from. And today, because of the high cost of healthcare and medical inflation, there's a lot of financial exposure to Medicare recipients. And because of this, insurance companies have created products to supplement Medicare A and B, or even downright replace A and B. To say it's a huge, confusing mess of options is the understatement of the decade. So let's get started. I've broken this video up into 4 different parts. Number 1, we're going to talk about Medicare eligibility. Number 2, Medicare enrollment. Then number 3, Medicare expenses. And then fourthly, the essentials of Medicare insurance. And then at the very end, I'm going to show you how to avoid the biggest mistake that people make when they go on Medicare. And so, first of all, Medicare eligibility. People are eligible for Medicare because they have paid into the Medicare tax system. Right now, if you're working, you're paying Medicare taxes, and so as long as people have accumulated at least 40 quarters, which is 10 years worth of work, they're eligible for Medicare benefits. A good general rule of thumb is if you're eligible for Social Security, you will be eligible for Medicare. Now, there are some that don't pay into Social Security that are still eligible for Medicare, but we have to have 40 quarters. Now, there will be times when people don't have their own 40 quarters, or they haven't worked 10 years paid into that system. And so what they have to do, if we can, is we'll actually draw those benefits off of a spouse. If someone's married and they don't have their own 40 quarters, they can draw from that spouse as long as the spouse is eligible for Social Security. They don't have to be taking, but they have to be eligible, which means they have to be at least 62. And as long as the marriage lasted 1 year, you can draw benefits off that married spouse. If you're no longer married, but were married and that marriage ended in divorce, the way that works is as long as the marriage lasted 10 years or more and you did not remarry prior to the age of 60, then you can actually draw benefits off of that ex-spouse. There are times when the spouse dies. And the way that works, as long as the marriage lasted 9 months or longer, you can actually draw benefits from that deceased spouse as long as there was no remarriage prior to the age of 60. And so the whole point is this: we're trying to find 40 quarters. Most people have that based upon their own work record. If not, we try to get it from a spouse. All right, and so that's who's eligible. Now, the second way people are eligible for Medicare, and that's those who have been diagnosed with either an emotional or physical disability, and they've been drawing Social Security disability benefits for 24 months. On the 25th month, they will automatically be enrolled into Medicare A and B, and so that's why we see people that are on Medicare that are 42 or 57 or 61, not yet 65, because they came through the disability system automatically enrolled into Medicare. Now, the second topic is Medicare enrollment. Now, keep in mind, if someone's on Social Security disability, they're automatically enrolled into Medicare A and B on the 25th month. There's also another group of people automatically enrolled into Medicare, and that's anyone that is receiving Social Security retirement benefits or spousal benefits, or actually widow or widower benefits. You'll automatically be enrolled into Medicare, nothing you have to do, and the Medicare card shows up about 100 days prior to your birth month. So in this instance, people are eligible for Medicare on their 65th birth month. Now, the exception is if you're born on the first day of any month, they always start you the previous month. But if you're born on the second day to the end of the month, you'll always start your Medicare on your birth month. And so if we're going to start Medicare at 65, and I want to make sure you're clear who has to do that. Anyone that's covered by a retiree plan, a COBRA plan, an Affordable Care Act plan, or in a group plan of 19 or less insureds. That group of people must start Medicare at 65. So if you're on Social Security, they automatically enroll you. But if you're not and you need to start at 65, you have to self-enroll. You have to make that enrollment happen. We call that your initial enrollment period. And here's the key. It only lasts for 7 months. And so if I have to start at 65, I have 7 months to do it. Those 7 months are 3 months before I turn 65, the month I turn 65, and 3 months after. And when I enroll during that 7-month window, then that will determine when my Medicare benefits begin. And so if I have to start at 65, you've got to do it during the initial enrollment period. You were not automatically enrolled because you weren't on Social Security. You had to make that happen. Now there's a second group of people that are going to come into Medicare at a later date. And this would be people that are covered by they or their spouse's employer-provided plan, and there's 20 or more in the group. That group of people doesn't have to do anything with Medicare A or B. Now you'll hear that you have to take Medicare A even if you keep working, and that's not true. In fact, some of you don't want to take Medicare A if you're still working because you're contributing to a health savings account. And if you take any form of Medicare, you can no longer contribute to your HSA. And so I would encourage you don't have to do anything with Medicare. And so you will come into Medicare at a later date. You may be 67, you may be 69. And that process is a little different. It's called the special enrollment period. And what is required to come into Medicare beyond 65 is we have to have 2 forms filled out. One of those is called an L564, which comes from your HR department. And they're going to verify that you've had insurance and you've been working back to 65. And then the other form is called the CMS 40B. And that's the form we use to tell Medicare when we want to start our Medicare benefits. So if my group plan ends July 31st and I want to start Medicare August 1, I will put that on the CMS 40B saying, please begin my Medicare August the 1st. So we select the date that we want to start Medicare and we turn that paperwork in no sooner than 90 days of when we want our Medicare to begin. So we come in at 65 using the initial enrollment period, or we come in at a later date using the special enrollment period. Now the third important topic is Medicare expenses. So I want to talk first off about Medicare A and B. Now, for most people, Medicare A will be free as long as we have the 40 quarters paid in, or a spouse that we're drawing benefits from has the 40 quarters. Medicare A will have 0 premium. It's called premium free for life. Okay, now there are some people that don't have 40 quarters. They actually can buy Medicare Part A. It is expensive. Right now it's $274 a month if someone has between 30 to 39 quarters. Or it's $499 if someone has less than 30 quarters. And so some people do have to buy a Medicare A, but for most of you, it's going to be free. Now, the B side of Medicare is not going to be free. B is always going to have a premium, and that is going to be based upon your income. That income specifically is called your modified adjusted gross income. That is your adjusted gross income plus tax-exempt interest. That tax-exempt interest is a number reported on your tax return. You add that to your adjusted gross income, and that number is used to determine what your Part B premium will be. Now, if I start Medicare this year in 2022, Medicare is going to look at the modified adjusted gross in 2020. They always look back 2 years to determine what we pay for Medicare B. And so we have 2 schedules available to determine our Part B premiums. One of those is for single filers, the other one's for married filing a joint return. So single filers that make below $91,000 or a couple that makes below $182,000 will pay $170.10 a month for their Medicare Part B. That Part B amount is deducted out of our Social Security checks. If we're not on Social Security, they will do a monthly bank draft or they will send us a quarterly bill. All right, and so we have to pay for Medicare B, and it's all based upon our income. Now, if we're above $91,000 as a single person or above $182,000 as a married couple, then we'll have an extra amount that we pay for our Medicare B and D. Those specific amounts are called IRMAs. They're basically a surcharge for those of you that are high income. So if you're higher income, then you're going to pay more. And that ranges anywhere from about $80 extra a month to close to $500 extra a month. And again, it's one of those issues that you're just going to pay an additional amount, but it truly is a good problem to have. Now, sometimes people are high income and then they retire and then their income goes down. So what we have the right to do is to appeal the IRMAs. So basically we say to the government, stop looking back 2 years. I've had a life-changing event. There are 8 such possible events. Usually we use work reduction or work stoppage. But if we have one of those life-changing events, we can tell the government that we have new numbers down. We want them to look at the new numbers, and they will do so, and those will bring those monthly Part B premiums down. But all of us have to pay for our Part B. So A is free, B has a premium. So beyond original Medicare A and B, then we're going to need some additional insurance. And so that brings me to my fourth topic, and that is the essentials of Medicare insurance. When we've made the decision to go on Medicare, either at 65 or later if we keep working, and then we retire and come on to Medicare, we have two options available to us for using our Medicare benefits. I'd like to call them two Medicare systems that are available. One of those systems is to stay in the original Medicare A and B system with a supplemental plan and a drug plan. The other one is to come out of A and B, and actually it's replaced by what is called an Advantage plan or replacement plans. They're also called C plans. So those are two broad categories of insurance options available, A and B with the sup or an Advantage plan. And so there's only one thing that these two systems have in common, and that is we have to be enrolled in Medicare A and B in order to be in either one of those systems. So again, A is free for most people. Most people are paying $170.10 a month for their Medicare Part B. Again, if you're high income, you pay more. But then $170.10 is paid in both systems, A and B or in the Advantage plan. Now, beyond that similarity of paying A and B, there's scores of differences. In fact, these two systems work totally differently. And so I'm going to begin by talking first about the original Medicare system. So when we decide to stay in original Medicare A and B, the first thing you have to realize is that we have no networks that we have to be concerned about. If I have that red, white, and blue card and I go to the doctor or the hospital, as long as that provider will take Medicare, then I can go anywhere that I want to. So there's no network whatsoever. There's no HMOs or PPOs. Now, in the Advantage system, there will be HMOs and PPOs, but with original Medicare and supplemental plans, no networks. Now, number two, the reason people actually buy supplemental plans is because Medicare pays, but they don't pay anything 100% other than preventive services. So whatever healthcare services I get beyond preventive, there's going to be an out-of-pocket expense to me. We call those gaps in coverage. And so those are financial liabilities that you will have to pay when you get healthcare services. And there's actually three gaps on the A of Medicare, which is the hospital side, which is the inpatient side, and the skilled nursing side of Medicare. You have gaps there. We have a deductible, and we have a couple different co-pays for extended hospital stays and extended skilled nursing stays. And so there's three gaps on the A. On the B side of Medicare, which is everything that would be doctor-related services or outpatient services or durable medical equipment, that's what B is going to cover. We also have three gaps. We have a very small deductible, and then we have co-insurance of 20%, and then we have the possibility of what's called an excess charge, and that's when a physician adds to the bill 15%. So we have three gaps on the A, and we have three gaps on the B. And so most people that stay in that system don't want the liability of those gaps, so we can take those financial gaps and we actually can transfer those to an insurance company. We say, I don't want to pay those bills, and we transfer that to an insurance company. They take that risk, that liability from me, and of course I have to pay them a premium to take the liability. No different than homeowners insurance or automobile insurance. We can eliminate the risk by transferring that to an insurance company, and we pay them a premium to take it. And that's what we do with original Medicare. We transfer the risk away fully or almost in full. Now, right now, the top three plans for Medicare supplemental plans are Plan F, Plan G, and Plan N. Now, the F plan is a full coverage plan, meaning that insurance company would cover all the gaps. Now, the issue is with the F plan is, number one, it's pretty expensive right now. But number two, most people cannot get F plans because to get an F plan, you have to have been born before January 1st, 1955, which means you started Medicare before January 1, 2020. Anyone in that group can still buy an F plan. But people born after January 1st, 55, F plan is no longer an option, and so the plan that replaced that would be the G plan. Now remember what we're doing. We have a Medigap policy. It's filling in the gaps. F filled in all the gaps, highest premium plan. The G is going to fill in 5 of the 6 gaps. And the only gap the G does not cover would be the Medicare B deductible. That's the outpatient side of Medicare. This year, that deductible is $233. So the first $233 of anything on the B side would be coming as a bill to your mailbox. You're going to have to pay that first $233. It's once a year, and that number resets every January. All right, so the next plan that some people are purchasing is called an N plan. Again, it's going to fill in gaps, and some you'll be responsible for. So the N plan covers all the gaps, but the B deductible, remember this year $233, it doesn't cover excess charges. Now the G and the F covered excess, but N does not. So if you happen to go to a doctor, Mayo Clinic, MD Anderson, or any place where they charge excess and they add the 15%, the N plan would not cover that. You would have to pay for that out of pocket. And then lastly, you have a couple copays on the N plan. Every time you see a doctor, you could pay up to a $20 copay or go to the emergency room up to a $50 copay. So what's happening is we lower our premium and we take on a little bit more liability with the N plan than we would the G plan. And the whole point is this: we can transfer the liability away and we pay a premium for that coverage. Now, beyond A and B and our supplemental plan, we also have to have a drug plan. And in this system, that drug plan is called a standalone drug plan. It is a totally separate plan, a separate premium, and probably a separate company. And we simply take your medications and match up the right prescription drug plan for your specific meds in the pharmacy you want to go to. So that is one system, A and B, with a supplemental plan and a drug plan. The other system that we have available to us is called an Advantage plan, or C plans, replacement plans. Now what we have is a private health insurance company that's replaced A and B for you. Now you're still paying your B premium, but now that health insurance company is now responsible for you. And in this system, what they will do is they'll put together a series of copays and a series of providers that will take the plan, and you pay copays, and all those copays are going towards an annual max out of pocket. So how this system differs is, number one, we have a network of doctors. Either it's an HMO or a PPO, and you have to choose whatever network is going to work best for you. HMOs are typically smaller, and HMOs oftentimes will require referral to see a specialist. An HMO also has a restriction that you must stay in your network. PPOs, a little bit larger, you don't have to have a referral to see a specialist, and you can go to network. It just costs you more to do so. And so we have a network with Advantage plans. Secondly, what we have is a series of copays. Now, there are a few things on an Advantage plan that will be at no cost to you. In fact, those are advertised as zero cost, but most things on the Advantage plan are going to have a cost. You'll pay a copay to go to the hospital, to have a CAT scan or an MRI, or to go to a specialist, have an outpatient surgery. You have a copay. So the Advantage plans are copay-based system, and those copays are going towards the annual max. And sometimes those are as low as maybe $2,500 to $3,000, upwards to $10,000. So that's your liability. You pay as you go. So in the supplemental plans, we pay a premium. We're pretty well done. With an Advantage plan, we pay as we go until we hit the max for the year. And then when it comes to prescription medications, the Advantage plan will actually include or embed a prescription drug plan within the plan. So they actually have chosen a drug plan for you, and sometimes they're very good and sometimes not so good. But that's why we always say make sure, if you're on an Advantage plan, that we also have good and adequate prescription drug coverage. All right? And so lastly, I just want to share, as far as these two plans, the way they differ is Advantage plans, again, are network plans. They're copay based. Medicare is premium and no networks. Also, Advantage plans require pre-authorizations, and that means that there's some healthcare services that your doctor does not have the final say-so. Doctor says you need a full hip replacement, but that Advantage plan must approve that decision. And if they don't, then you're not going to get that service. With supplemental plans, there's no pre-authorizations. If the doctor says you need it, Medicare says they'll cover it, then it's on the schedule and it's taken care of. And it's just simply a difference. And then lastly, when we switch plans, there's some rules. Number one, when I take a supplemental plan, when I first go on Medicare, I have this period of time that lasts 6 months. 6 months before I turn 65 or 6 months after, where I actually can apply and get any supplemental plan of my choice, any company, any letter, and the company has to write me regardless of my health conditions or any pre-existing conditions that I may have. But beyond those 6 months, in most states, in order for me to get a new supplemental plan or to switch them, I now have to medically qualify. All right. Now, if I start with an Advantage plan, what happens is I'm on that Advantage plan. If I stay on that Advantage plan, let's say a year, 2, 3, 4, 5 years, and if I ever want to move to a supplemental plan, now I have to medically qualify to make that switch. And so many people think they can be on an Advantage plan for 5 years, and now they're approaching 70 and their health begins to change. Now they want to switch over to a supplemental plan. You cannot make that switch without the medical underwriting, so that insurance company actually can decline you. They actually have to approve you to make that switch. All right, and so every year we have this opportunity from an Advantage plan or prescription drug plan to switch those plans with no underwriting. But if I want a supplemental plan, I have to go through underwriting. So those are the essentials. And that brings us to our final topic. Remember earlier I'd said that I will tell you what I think is the biggest mistake that people make when they first go on Medicare. And that is this: when they do not get the right type of assistance. Now folks, there's some people actually will try to do this Medicare on their own. I would really discourage you from trying to do it by yourself. Now, I'm kind of a do-it-yourself guy. I enjoy tackling projects. I like figuring things out, and usually I do so because I'm going to save money. Well, when it comes to Medicare, it can be very difficult to figure this out on your own, and I promise you, you will not save yourself any money whatsoever. In fact, you could cost yourself multiple thousands of dollars if you make some kind of a mistake. All right, and so I wouldn't do it yourself. Secondly, if I were going on Medicare, I would not use what is called a captive agent. Now, captive agents aren't bad people, but a captive agent means that that agent works for one company and only one company. In most markets, we're going to have anywhere from 10 to 15, maybe 20 companies to choose from. When you work with a captive agent, that means they work for one company and they only represent that limited amount of products and portfolio. So you don't have a lot of options. You have really nothing to compare your options to. And so that's why many, like us, have chosen to be independent brokers. And so with an independent broker, you get all the options. We write for all the companies, and we can actually take all the companies, their premiums and their plans, and we set them side by side and make a comparison so that whenever it's time for you to go on Medicare, you have all the options available and you choose the one that's best for your specific situation. Because you see, folks, one size does not fit all in the Medicare business. We have lots of options. So independent brokers will show you all those options. And so I would encourage you to use someone that is knowledgeable, that's experienced. Our goal when we help people is to make sure, number one, we understand their situation. So we like to ask a lot of questions first to see if you really do need to go on Medicare. And if it's time to go on Medicare, then we actually will work with you through that enrollment process of A and B, and then help you look at all the supplemental plans, the prices, and make those comparisons. And then it's very important that you pick out the right prescription drug plan as well, because medications are very, very expensive. And so be sure that you get the right kind of assistance. And remember, whoever you use is not going to charge you any money, because the insurance agent is always paid by the insurance company. We don't set the rates, and you don't have to pay us. The insurance company takes care of all that. So here's the question that I would love to hear your answer to. Based on what you just learned, are you going to use a captive agent, or are you going to use an independent broker to assist you through this process? So please let us know your answer to that question in the comments below. Hey, thanks so much for watching the video. Subscribe and ring the bell for more content just like this. And if you want to continue to learn about Medicare, feel free to click or tap on one of these other videos. This channel is truly all about helping you avoid Medicare mistakes. And as always, I wish you the best on your Medicare journey. Talk to you soon. Hey, thanks so much for watching the video. Subscribe and ring the bell for more content just like this. And if you want to continue to learn about Medicare, feel free to click or tap on one of these other videos. This channel is truly all about helping you avoid Medicare mistakes. And as always, I wish you the best on your Medicare journey. Talk to you soon.